Hi, everybody. Well, we are all still in the middle of this Omicron surge, but there is some good news on the horizon. And so let me go ahead and start sharing my screen with you so I can give you the update for this week. So to just give you an overview, it looks like globally the peak has occurred now. There are still hotspots everywhere, but there does seem to be some decreasing off of the peak in most areas around the world. Certainly it looks like in the US and California overall, we may have reached our peak as far as cases go. Unfortunately, there is always a lag in hospitalizations and mortality, so we're still seeing those rise, as I'll show you. Just to start with the variants as usual, Omicron is now over 99% of all the variants, and you can see geographically how that is spread out. It's kind of everywhere across the country. It's almost all Omicron. When you look at Santa Clara County, this website does lag a bit, but you can see that the number of Omicron cases has certainly climbed compared to the last time I showed this to you. And just to answer that question of whether or not people are actually being hospitalized for COVID or just with COVID for other reasons. And you can see that at least in certain areas, for example, in Los Angeles, about 40% of patients may be hospitalized for other reasons and are just testing positive because it's so contagious. But about 60% are actually there for COVID-related illness and are being hospitalized for that. About 15% of those patients are in the ICU, in LA at least. And so it really is not just a mild disease in everyone. If you look at this interesting article out of Japan, this data, although it's only a small number of cases, 21 cases that they looked at, they did show that the amount of viral RNA was highest 3 to 6 days after diagnosis or symptom onset. And so the California public health decision about decreasing the isolation period to 5 days, but only coming out of isolation once you have a negative test appears to be borne out by this data, that a negative test at that point really is still important. Of course, staffing and ability to continue carrying out our economy and really important roles that people need to serve will always weigh into these decisions. But as far as the straight science goes, certainly it seems like a test would be necessary to prove that you are not still shedding quite a lot of viral load at 5 days. When you look at the T cell activity against Omicron, this is that summary that Eric Topol has put together and just added this last one at the very bottom from the University of Arizona. And again, showing markedly improved T cell response after the booster. And this graph just demonstrates that really nicely, that the T cell response after that 3 times vaccination is just significantly higher again. In the ancestral strain, you can see it brings up the immunity right up to around where the people are with a primary infection or a prior COVID infection. You can see with Omicron, it really boosts immunity quite far past that, which could have been gained by a prior infection. So even people with prior infection will benefit from getting all 3 doses of the vaccine. Now we can talk about vaccination. So that's basically showing the US right where we have been for a while now, just over 60%. And when you look at the overall doses, it's over 209 million fully vaccinated. That's 67% of our population over age 5. And when you look at the age over 65, it's up to 88%, which is good. When you look at the booster doses, however, it's not doing as well. Keeping in mind what I just showed you about how much our T cell immunity is affected by the booster dose, and less than 40% of our eligible population has received one. So we should certainly encourage others to do so. When you look at the rate of administered doses, you can see there was a little bit of a jump at the beginning of January, but now kind of down again a bit. And when you look at who those people are, it's both people receiving the booster as well as people getting 1 dose or fully vaccinated. That jumped a bit and now is back down. When you look at the percent of each state fully vaccinated, we continue to see the same trends that certain states are not moving very rapidly. You can certainly see areas like Massachusetts and Maine doing a great job, over 74% of their population fully vaccinated. In California, you can see we are dosing at a rate of about 0.17 million per day. And when you look at that status broken down by age group, you can see that overall, compared to the overall US population, we're doing quite well with our population. But when you look at that age over 65 population, again, we're still lagging behind the country overall. When you look at Santa Clara County, we are doing quite well. 92.9% of the overall age groups 18 and older populated are vaccinated, and Santa Clara County 65.9%, age 5 to 17% vaccinated. And even we're doing better with the booster dose. Almost 60% of people eligible have received a booster here in Santa Clara County. When you look at the age over 65, doing even better, 95% of our residents over age 65 are vaccinated. When you look at global cases, you can see that there has been this 61% increase over the last 2 weeks, but when you look all the way over at the edge of that graph, you can see there's a little dip off of that peak, which is great news. And that increase is actually much down from the over 100% increase from the prior 2 weeks. The areas that are hot are still basically the same areas, maybe a little increase in the Southern American continent, but everywhere else pretty stable where they have been. And this is always interesting to compare countries and how they're doing. You can see that many countries are coming down off their peak, especially places like Canada, the UK. And you can see that the United States also is coming down a bit. When you look at Israel, it's very interesting to see that they continue to rise. And this is interesting because they have rolled out their 4th dose of the vaccine campaign. And what you can really see in their data is that there is not really any effect that is being shown on the amount of Omicron cases overall. Perhaps it will bear out in the overall hospitalization rate, but not in the overall cases that are being contracted. When you look at national cases, you can see that we also have an increase of 37% in the last 14 days. That's a much improved increase percentage, much decelerated increase. And you can see that there is a little bit of a dip off of that peak at the very end of the graph. You can see that we are still hot almost everywhere in this country, although you can see Maine really remains an exception, and it is the most highly vaccinated state, which I think is likely why we're seeing that. When you look at California cases, it does appear to be coming down off the peak. It increased 107% over the last 2 weeks, but that is much improved from the huge increase that was in the last 2 weeks prior. When you look at Santa Clara County, the cases are certainly still very high, but coming down off the peak. And San Mateo County, also very high, but coming down off the peak. And when you look at Stanford cases, you can see very nicely, remember the positive cases are the numbers in red, and the blue bars are just the number of people tested. So you can see in that first week of January was really the highest number of positive cases at 494 students testing positive. We still have a high number this last week at 205, but that's decreased from prior. And our overall positivity rate is just at 1.6% compared to California, which is at 21% positivity rate. This holds true for our Stanford faculty, postdocs, and staff as well. You can see that the high increase in number was in that first week of January, still high, but lower in this last week, and our overall positivity rate of 2.6%. When you look at COVID in pediatrics, this is some data that many people have asked me about, new data released from the CDC using these databases, the IQVIA and Health Verity, showing that new diabetes diagnoses were definitely increased and more likely to occur among pediatric patients with COVID-19 compared to those without during the pandemic. There are many factors that may be playing into this, but certainly interesting to note and a little bit sobering compared to people saying that it's just a mild disease in kids. When we look at overall pediatric data, you can see there was a 20% increase in the accumulated number of children since the beginning of the pandemic, more right up around the November numbers when we compare the overall percentage of pediatric to adult cases, but hospitalizations and mortality remaining quite low. And when you look at overall hospitalizations, you can see that this does still continue to increase. There's always a lag behind the cases, so 47% increase in the last 2 weeks overall across the US. And when you look at California, this also holds true. You can see that it is still rising, both overall in the hospital system as well as in the ICU patients. And when you look at Santa Clara County hospitalizations, they are also still rising. So still a ways to go before we're through this. San Mateo hospitalizations appear to maybe be stabilizing, which is great news. San Francisco hospitalizations continue to rise at a high rate. When you look at mortality nationally, you can see that there has been a rise. There's a small dip at the very end of the graph, and it's hard to know, is that just because many states didn't report data over this MLK weekend, or is that truly a dip off the peak? When we look at mortality in California, you can see that we are still rising here in California as far as mortality goes. And then Santa Clara County, pretty stable as far as mortality. There were 17 deaths over these last 2 weeks. And if you recall, the 2 weeks prior, there were about 14 deaths. So pretty stable. Finally, just to close out with some news that's been out there just to answer people's questions, this Deltacron variant located in Cyprus was identified. Many people think that this is maybe just lab contamination, that it's not truly a new variant, although the scientist that discovered it says that that wasn't an error and that it is real. So still the jury is out on this one, and I will simply track it and let you know over time. And then finally, I thought this was just a good way to end out. This is data from the UK, specifically a technical briefing on Omicron data, showing that the vaccine effectiveness against hospitalization, if you look at that third dose of the vaccine, really nicely high efficacy against hospitalization, especially when you compare it to that number of 44% when you go look at just after 2 doses of the vaccine, if you're 25 weeks out or more, only 44% efficacy against hospitalization. So just again, emphasizing how important the booster dose is to avoid severe disease. And with that, I'll stop sharing. And I hope all of you gain some knowledge from that and can make good decisions. We are still definitely in the thick of things, but it does look like there is an end in sight, at least to this surge. So I hope you guys have a great 2 weeks until I see you again. Bye-bye.